Hello, everyone. All right, I think it's about time we began. I want to thank everyone for joining today's webinar. A few housekeeping notes before we dive in. Please know that everyone is muted upon arrival to allow our presenters to share undisrupted. That said, we would love to hear from you. If you have a question, we ask that you type it into the Q&A box at the bottom of your screen. Select audience questions will be answered in that box, but several more will be answered directly from our presenters at the end of tonight's session. Please note this meeting is being recorded and will be available to view on demand later this month. To make sure you are alerted when this is posted, be sure to follow Elsevier Student Life on Facebook. We have a fantastic presentation planned for you this evening that should last between 45 minutes and an hour. Tonight's presenters will be leading a question and answer based session where they cover a few items that students often ask about their NCLEX, as well as an opportunity to hear from two students who recently passed their NClex-pn and nclex-rn exam as well. So we look forward to engaging with students, hearing your questions, and sharing how you can best prepare for the NCLEX. Without further ado, I'd like to turn it over to Elsevier authors and tonight's presenters, NCLEX gurus, Linda and Angela Silvestri.
Thank you, Abby. Well, welcome everyone. It's so great to have you all joining us tonight. There's so many of you out there joining, and this is fantastic. We are so excited for the opportunity to spend some time with you this evening. My name is Dr. Linda Ann Silvestri, and myself and Dr. Angela Silvestri, who is also with us this evening, want to thank our RN and our PN graduates, Abby and Karen, for spending this time with us to answer any questions that you may have. These graduates have had a first-hand experience with the NCLEX, so they will be able to share what it is really like. And by the way, Abby and Karen, we're very proud of you both. So we're going to talk a little bit about the NCLEX changes as far as COVID and a few things about the test plan, and then we're going to turn it over to our graduates. Okay, so it's really important for you to visit the NCSBN website to keep updated on the changes because of the COVID crisis. And what the NCSBN put into effect on March 25th is extended now until September 30th. So this is for both RN and PN tests. So if you plan to test after September 30th, be sure to check the NCSBN site for any updates. Okay, on this next slide, we have some information that affects seniors getting ready to test. Now, according to the NCSBN, modifications were made to support the flow of new nurses into the healthcare system while minimizing the risk to test takers and to test center staff. And as I mentioned, note that these modifications will remain in effect until at least September 30th, at which time the NCSBN will then determine the need to extend the modification time. What is significant to note on this slide is that for both RN and PN, it will be a 4-hour exam, and both exams will be comprised of a minimum of 60 questions to a maximum of 130 questions. There are no experimental or pretest questions on this exam during the COVID crisis, and there will not be any research section on the next generation NCLEX questions. So those will not be on the exam. These modifications do not make the test more difficult. Psychometricians have found that they can validly and reliably determine competency with these number of test questions. Now let's take a look at the next slide and with regard to the testing environment. Now it may be a bit difficult to schedule your exam because NCLEX is limiting the number of test takers per day. And again, you also need to remember that not only RN and PN tests are being administered at the testing centers, medical exams and first responder exams are a few of the other types of exams being administered at this time. but all CDC disease control guidelines are being followed in the test centers, including enhanced cleaning, especially between each test taker. Now, the testing center is providing essential items such as hand sanitizer and paper towels. A declaration of wellness at check-in is also being done, and they're asking each candidate if they've exhibited COVID symptoms in the last 14 days, and asking the candidate if they have been in close contact with anyone who had COVID-19 or had symptoms of it. The social distancing guidelines are being followed, such as 6 feet distancing. Identity procedures are done at a distance, at arm's length, and the palm scanner is cleaned between candidates. Now, face masks and gloves are permitted. You can wear them, but you must bring your own. They will not be provided at the test center. So on the next slide, we have listed the components of the test plan, and I'm going to turn this over to Angela.
Thank you. So I'm going to briefly go over the components of the test plan. So on this slide, you'll see the 3 components of the test plan: the level of cognitive ability, integrated processes, and client needs. These are the major framework for the test plan. These components are used to guide the development of test questions for NCLEX. So in other words, the questions are written to address these levels of the 3 components. And if we go to the next slide, we can take a closer look at each of the levels of cognitive ability. The levels of cognitive ability include understanding, applying, analyzing, synthesizing, evaluating, or creating. However, it's not at all likely that you'll encounter questions that address the level of understanding. Questions are written at the applying level or higher because the practice of nursing requires clinical reasoning and clinical judgment. This means that you'll be required to apply, analyze, synthesize, and evaluate the information provided in the test question. And you'll also be required to use the level of cognitive ability creating, such as in creating plans of care or teaching plans for patients. On the next slide, we've listed the integrated processes. The NCSBN has identified 5 processes as components of the test plan that are fundamental to the practice of nursing. These include caring, communication and documentation, culture and spirituality, the nursing process, and teaching and learning. So what this means is that each test question will address one or more of these components. Moving on, the next slide illustrates the client needs categories of both the current RN and PN test plan. And this information is from the NCSBN, the 2019 NClex-rn exam test plan, and the 2020 NClex-pn exam test plan. Don't feel like you need to write all of this down right now, because if you download the test plan, which is something that we do highly recommend that you do, all of the information and the percentages that you see on this slide are presented in that document. The NCSBN identifies 4 major categories under the heading of client needs. These include safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. Some of these categories are further divided into subcategories, and the percentage of questions varies in each category. So just a few things that we want to point out to you tonight. First, you can see that the safe and effective care environment and physiological integrity categories comprise the highest percentages. And so you want to be sure that you're very strong in the management of care and safety and infection control areas. And with the COVID-19 pandemic, you're certainly likely to see transmission precaution questions. And so you want to be sure that you're really proficient in the theory and in the application of those principles. And also, because physiological integrity is a high percentage, you're more likely to see adult health questions. So note that the health promotion and maintenance and the psychosocial integrity are going to be your lowest percentages on the other hand. And so you may or may not have maternity questions, you may or may not have mental health questions. It's important to still be prepared in those areas, and also to keep in mind that everybody's exam is a little bit different, and I'm hoping that the graduates that you talk to today will be able to provide some insight into that. Then moving on to the next slide, You can see here what the types of questions are going to be on the exam. So you'll have multiple choice questions. These provide 4 options. Multiple response questions tend to be very common, which require you to select one or more answer to that question. There's fill in the blank, which often asks you to solve a calculation and to fill in the number. There's ordered response or prioritizing questions, which require you to rank the answers in order of priority. There's figure or image, also known as hotspot questions, and these include a figure or an image, and you'll have to look at a particular area of that image and then answer a question about it. There's chart or exhibit questions, which provide information in the form of a chart or exhibit, and you must refer to that in order to answer the question and use information from the exhibit in order to answer the question. Audio questions are questions that are accompanied by an audio clip, such as breath sounds. And then there's graphic option questions, which present graphic answer options instead of text answer options. And so it's helpful to have an idea as to what item types you may encounter on the NCLEX. Okay, so now what we're going to do is turn the presentation over to Abigail and to Karen. We'll start with Abigail.
Hi everyone, I'm Abigail. I graduated from nursing school with my Bachelor's of Science in Nursing on April 20th of this year, and then I took my NCLEX on May 10th. Something that I wish I'd known going into the NCLEX was a lot of people mentioned to take the day off beforehand and just kind of relax, and I didn't take that to heart. I wish I had. I think it would have helped me feel more relaxed and comfortable going into it and just kind of give my brain a break. So that's something I would definitely recommend doing.
Karen, if you'd like to jump in at this point, that would be great.
Hi everyone, I'm Karen. I'm a graduate from Greenfield Community College in Greenfield, Mass. With a licensed practical nursing program. I felt confident with the content and the questions from the Saunders Silvestri comprehensive book I did. The one thing I felt I wish I would have known was going in, I was a little stressed. I had a piece of jewelry that was special to me, but I didn't know I could have with me. So I needed to put that into a locker. So I would suggest going on to the NCSBN and looking at the guidelines for when you go in to take the NCLEX. So that's one thing I wish I would have known. Thank you.
Wonderful, thank you ladies. So now we're gonna just open it up to student questions and answers, and these can be for Linda and Angela, our expert authors, or Abigail, who just took her NClex-RN this year, as we heard, or Karen, who just took her nclex-pn this past year, like we heard. Of course, both of our students did pass. Both of them are familiar with the Saunders products and with Elsevier as well. So we're gonna go through some audience questions at this time. I do see a lot of questions in the Q&A box that are particular to local testing centers. And before we get started, I did want to mention if there are questions that are specific to your local testing center, we'd like to refer you to the NCSBN's website for more resources there. We'll include a link to this website and the test plan blueprint in a follow-up email for you all as well. All right, so the first question is, how should I study and get ready? What would the students on screen recommend?
Abigail, you want to start with that question and then turn it over to Karen? I think it's a great question.
Yeah, so I think initially coming up with a way that makes the most sense to you to kind of break down the content is a great place to start. For me personally, I worked through the lifespan, starting from like prenatal, conception, and then working through pregnancy, labor and delivery, the birth of a newborn, care of a newborn, peds. With peds, I added in mental health, and then through adults and kind of through the body systems of an adult. I think that that kind of helped me with a starting point. And then I used the textbook quite a bit to read up on topics that I felt like I was struggling on. And then I really honed in on practice questions. I think the more practice questions you can do, the more exposure to those types of questions that are going to be on the NCLEX, the better. So I think just reading and really focusing in on any practice questions you can is a great place to start. And then I'll pass it on to Karen.
Hi, I would also recommend practice questions. That's what I focused on. I did about 200 questions a day, and I focused on different content areas that I was struggling in and my weaknesses too, to help me strengthen that first. I also suggest when you're doing the practice questions to always read the rationale and the strategies. Those always help you to, when you're breaking down the question, to explain the answers to you. And then I also always used both books. I used the Saunders Comprehensive and the Q&A. They both have different questions and content. So when you go online and you do that, it's great because it has the different contents you can pick and go over the different sections that you want to focus on, and then do them all together on one. So I would suggest that, and that's what I would do. Thank you.
Great. Thank you. So Linda, we have one for you that I believe you had actually answered in our very first webinar last month. We have a lot of students who are concerned that they're currently working in a hospital situation. They might have had recent exposure. Would they be turned away if they don't have COVID symptoms from a testing center?
Okay, you broke up on a little part of that. If you could just repeat that question. Thank you.
Sure. So we have a lot of students concerned who are currently working in hospital situations and have had potential recent exposure, but they aren't exhibiting symptoms. Will they be turned away from the testing centers?
Okay, and Angela, you can jump in on this one also. They're going to ask, and Abigail, who has recently taken the NCLEX during the COVID pandemic, can let us know what her experience was also. But as long as you are not exhibiting any symptoms, they are probably going to ask if you've been exposed, and I think explaining that you've worked in a hospital, I'm not positive if they're going to turn you away. Angela, anything to add, or do you have any information from any students? I've never heard of anyone being turned. You do? Good.
Well, I can provide a little bit of insight into this just based on my experience working with students at the nursing program that I work at, and based on CDC guidelines, how I suspect this would be handled. And the first thing that I want to say is that just because you're working in a hospital does not mean that you have had an exposure. The idea is that if you do have the proper protective equipment at the time that you're caring for a patient that's positive for COVID, then that would not be considered an exposure. Now, if you're caring for a patient and for whatever reason, the processes were not put into place initially, and they go back and they do the contact tracing and they determine that in fact you were exposed, which means that you were exposed to somebody who was determined later to be positive, and that you and or the patient did not have the proper precautions in place, then that would be considered a positive exposure per CDC guidelines in a healthcare setting. And so it really just depends on what the nuances of those individual circumstances are. But as Linda mentioned, the questions that will be asked will be about, have you tested positive for COVID, had symptoms of COVID, and it may ask questions about being in direct contact with somebody or a person under investigation for it. So this is just based on my experience. I suspect that various testing centers may have some differences in their procedures. And so depending again on those individual situations, You know, it could be that you're turned away. It just depends on what's going on. You may not be turned away. So I guess my advice there would be to try to communicate as soon as you know about the fact that you may have had an exposure or you've been exposed to somebody who's under investigation, then to contact somebody at that testing center to seek advice from them. But again, just because you're working in a hospital environment does not necessarily mean that you've had an exposure. And Abby, if there's anything that you'd like to add to that, that would be great.
I think you covered it. I completely agree that I can't really speak to what potentially could happen if you were exposed, just because it didn't happen to me, so I don't know. But along with what Angela said, they just ask questions of, have you been exposed that you know of? Have you had symptoms? Have you yourself tested positive? And then I agree, I would just reach out to your testing center from there and kind of see what their recommendations are.
Awesome, that's really helpful, Abigail, especially coming from a student who was able to take their NCLEX during the global pandemic. So thank you for your insight and your advice to other students. Next question is for Karen and Abigail again. And we have some students wondering about how many questions you did before taking your NCLEX exam.
Okay, Karen, do you want to start with this one?
I practiced about 4,800 questions from both the Saunders Comprehensive Review and the Q&A book, and also doing Elsevier Evolve questions online. And Abby, do you want to add anything?
Yeah, so you did a lot more than me, but that's awesome. I probably did, I'd say 800 to 1,000. I don't know the exact number just because I was kind of flipping between my online resources and the textbook as well. But yeah, probably around 1,000.
Awesome. And how long did each of you wait to take the NCLEX after you graduated? We can start with Abby and then go to Karen.
I took my NCLEX as soon as I could. I applied right away. I know you have to go onto the Nursing Board of Registry in the state that you're applying for, and you have to upload a picture, and then you pay the fee. And then you also have to go through the NCBSN and apply through the Pearson VUE site, and you pay a fee for that, and then you wait for the ATT to come in. And that usually takes about 3 weeks to 4 weeks. And when that link comes in, you click on that ATT, which is the authorization to test. And then you can go through there and look through your state for a testing day. And if it's too far out, you can look into surrounding states. And I took mine in New Hampshire, and I live in Massachusetts, but I wanted to take it right away. I didn't want to wait. And in Massachusetts, it was about a 2 to 3 month wait. It was far out for a date. So I suggest trying to take it right away. That's my recommendation. I wouldn't wait too long, maybe a month. I feel if you take it right away and you're studying the questions through the comprehensive book and the Q&A, and the information you learned in nursing school and doing the practice questions, it's fresh in your mind. So I would wait no longer than a month and take it right away. And also the ATT, the link you receive expires after so long. If you let that expire, then you have to reapply and pay another fee. And Abby?
So I took my test about 3 weeks after graduation, but that said, I started studying probably like really studying about 6 weeks before my test date, specifically because with everything happening with COVID, my class load had changed. We weren't going on to campus anymore, so I was home a lot more and had a lot more free time. So I did start studying a few weeks before I graduated, but I did technically take it about 3 weeks after graduation. Along with what Karen was saying with the test dates, I know especially right now, a lot of states are having to push test dates out pretty far. So with what she said, I would try and take it as soon as you can, even if that means looking around to other locations or other states and kind of go from there. But I definitely agree that I think the sooner you can take it while giving yourself enough time to study is the best option.
Awesome. Follow-up question to that, Karen. We do have several students who are in New Jersey or New York, and they want to take their exam in a different state. Can you tell us a little bit more about your process of taking or looking to take the exam in a nearby state?
Sure. When I was looking in Massachusetts and the date was two to 3 months, I did look into the other states. You just click on the link. When you're looking in your state, it also lets you click on other states. You can put in the option for New Hampshire, Rhode Island, or Connecticut. I also checked the surrounding states that were close to me. And then dates will come up and you'll see them on the screen if they're available. And you can actually click on them and apply to take it there. So I did drive 2 hours away to take my test, but it also is a great option so you're not waiting the 2 to 3 months if your state has so many applicants taking the test.
One thing that I'd like to add to this discussion is the fact that Karen's describing that she sat for her test at a testing center located in New Hampshire. However, she was testing for a license in the state of Massachusetts. And so you can apply for a license in one state and then physically go to another state and do the test for a different state. So you don't have to test physically in the same state that you're applying for licensure.
Right, that's right, Angie, yes. Yeah. Thank you.
So the next question is probably best suited for our students on the line as well. What can students expect when they get to the testing center? And I know Linda and Angela covered this a little bit, but from your experience, can you share a little bit more about that process?
Abby, do you want to maybe start with that one?
Yep, I can start. I think that my experience might be a little bit different, just again, because of the pandemic going on right now. So along with what was mentioned earlier, you do have to wear a mask, and I think it varies from location to location, but the testing center that I was at specifically said that they would not have masks available, so you had to bring your own, and if you didn't bring your own, you were forfeiting your exam. So you don't want to do that, so make sure you bring a mask, and I definitely recommend leaving early because I forgot my mask at home and had to turn around, so have enough time in case you need to go back for something or, you know, traffic or whatever, so accounting for that is important. When you get there, they are social distancing right now, so there was a big gap, at least 6 feet, between me and the woman at the desk, and she just asked my name and looked me up. And what else did they do? I didn't bring my phone in, I left that in the car, but if you brought it in, they would make you put it into a sealed bag. They took my keys, they took my palm, they scan your palm to identify you. I had to pat myself down. I had a hoodie on, so lift my hood, shake that in and out just to make sure there wasn't anything in it. Lift my hair up. They wanted to check the back of my neck for anything. I had to take my glasses off and flip them all around so they could make sure there were no like cameras in my glasses. Just really patting down your sleeves and your pants. And yeah, they give you a whiteboard to use that's non-erasable and like a little dry erase marker, but it can't rub off. So if you try and rub it off, it'll just smear and make a mess. So if you need another whiteboard, you just raise your hand and ask for one. I know most testing centers offer ear protection, like earplugs or headphones. Mine did not. I don't know if that was something I could have asked for because I didn't ask for it, but yeah, I think that covers everything from my experience if you want to take over, Karen.
Yes, my experience was a little different. I did go in there with the jewelry, so they did make me take the jewelry off and also put it in the locker. I also did have my cell phone, so they did make me take my cell phone and put it in a sealed bag. They had to seal it, and they walked it over to the locker. And then also they asked me if I needed to use the restroom. And also they did check me too, to make sure that I had nothing around me. They also asked if I needed a tissue. They did give you 1 or 2 tissues you could take in with you. Where I took my test, they also offered earplugs and they had headphones. And then they walked you into where your cubicle was with the computer and explained to you how to use the computer. And if you needed to use the restroom, you were allowed to go and have 1 break. It was for 7 minutes. And if you took longer than the 7 minutes, then your clock for your testing would restart. So then it would run off the time that you have to take the total exam. And also when you finish the test, they walk you out. They also recheck you and they take you to the locker. They take everything out and they have to open your cell phone for you. You can't open the bag. And that's the experience I had with it. Thank you.
Thank you. So Linda and Angela, earlier in the presentation, you went over some of the types of questions on the examination, including multiple choice, multiple response, fill in the blank, ordered response or prioritizing, figure or image hotspot, chart exhibit, audio or graphic options. What is the likelihood that a student will see all of these types of questions on their exam?
Well, I think that's a great question to ask our graduates to find out what was on their test as far as the types of questions. And Angela can jump in. They're likely to see any and all types. And one of the types that we hear about that they have quite a few questions on are the select all that apply or the multiple response. And then if Angela has anything to add, and then perhaps we can ask Abigail and Karen what their experience was with the different types.
Absolutely. I think really the only thing that I might add to that is that graduates that I speak to, candidates that take the NCLEX, as Linda mentioned, the multiple response or select all that apply questions, and I'm not sure if this is because these are the ones that candidates tend to fear the most based on their experience with them, and because you have to have all of the correct options selected and none of the incorrect options selected, and therefore they're quite difficult. But it seems to be the case that they do have multiple, I've heard anywhere from, let's say in a 75 question NCLEX-RN exam, I've heard anywhere from 15 to 20 and up to 30 multiple response questions. And that's, really not meant to scare you, but more so just to give you kind of the insight and give you an idea of the fact that these are ones certainly that you should expect of those alternate item formats, and therefore they should be a big focus of your studies. And the comprehensive review and the Q&A do allow you to filter questions based on multiple response questions. But yes, I would agree, as Linda mentioned, it is possible that you would have, I would pretty much count on the multiple response and then also bargain for at least a couple of the other alternate item format type questions. The chart exhibit questions tend to be more difficult questions as well, and so those would likely be seen, and certainly you can encounter potentially all of them in a given exam. And with the way that the computer adaptive technology works, the testing works, is that it will pull based off of level of difficulty, and it doesn't pull necessarily off of the content area or the question type. But if a question is identified as a certain difficulty level, and that's an appropriate difficulty level for that candidate based on the way they answered the previous question, that in and of itself would kind of let you know that all of those are potentially fair game. And so that is why we like to let candidates know and our students know that these are things that they should practice all of them so that they're best prepared. And with that, I'll go ahead and turn it over to Karen or Abby, whoever wants to jump in.
So I think for me, there was definitely a lot of select all that apply. And one thing that I wish I would have done with studying was to set up a test that was just select all that apply and just do them one after another. Because I remember a portion of my test where it felt like they just kept coming, and I was like, oh my goodness, why is this happening? And you don't know what it's going to be like until you're in the test. So I think I'd recommend doing them just kind of one after another like that. I did have one audio. I had a handful of the exhibit ones, but I don't remember having any hotspots. So I'll pass it on to you, Karen.
I also had about 15 or 20 multiple response questions and select alls. I highly suggest doing, like Abby said, doing a test with the multiple response. And if you go into the Saunders Silvestri Comprehensive, there is the where you can select the study mode and select on the alternative item format and select the multiple response, and you can just do those, which is a great tool for studying. I also had questions on PPEs. I had questions also on who would you see first. I had therapeutic communication questions. I also had a drag and drop. And I also had questions, what would be the best option? So those are the ones that I followed through my exam.
Great, thank you. We do have a lot of other questions, particularly about lab values. And I know that that's something students are always curious about. How do you remember those lab values? How do you recommend preparing for those? And what was the experience like on your NCLEX-pn and nclex-rn? So Abigail, if you want to start this one, and then Karen, you can jump in and tell us a little bit about lab values.
Yeah, so I don't remember having too many lab values on my test. If I did, they were kind of explained in the question in a way that you really didn't need them for the answer. But for remembering them, I definitely prepared like I needed to know them for the test. One thing that I came up with that I felt like helped was mnemonic devices. So like just silly little sayings that might help it click in your brain. Works for me using flashcards, just going through the Saunders textbook and kind of making flashcards from the lab values that are there was super helpful. And just coming up with anything, even if it's silly or sounds like goofy at the time, if it helps you remember it, I think that's what's most important. So I definitely recommend coming up with those devices, making flashcards, anything that can kind of help it stick in your brain, because just because I didn't have that many on my test doesn't mean that they won't pop up.
And I also, for the lab values, I think I had 2 questions on my exam with those. I also suggest going onto the NCSVN and looking at the test plan. That's what I did. It actually shows you the lab values that will be on the exam. And I took those and I made a chart and then flashcards, and then I would study with the flashcards like Abby said also. And I think that's a great study tool, and using the practice questions, again, from the Elsevier Evolve website and the textbooks help a lot also.
Great, thank you. So we have a couple more questions. Let me see what we have here in the Q&A box as well. About how many select all that apply questions did each of you get? Again, back to that conversation, a lot of students are really concerned about that. You shared how you studied, but how much of the test would you say was those types of questions?
For me, I'd say I didn't count. I know some people will tally it on their little whiteboard. I didn't keep track, but I want to say anywhere from 25 to 45. Like I said, it felt like they kind of just kept coming in a way.
I had about 15 or 20 on my exam, and altogether I think it was about the 20 I had. So that's what I had.
Awesome. And then this question's for you, Linda. Students always wonder, if you miss one answer on a multiple choice question, does that mean you get the whole question wrong, or do you get partial credit?
Sorry, I had to unmute. Apologize for the delay. You must be talking about the multiple response questions?
Yes.
Okay. It's select all that apply. And so that's exactly what it means. You need to select all the correct answers. Otherwise, there is no credit given. There is no partial credit given. So you have to be right on with these types of questions. And I think that probably the best way to get ready for these is what Abigail and Karen suggested is, go into the comprehensive review book and the Q&A book, select that alternate item format. And if you select multiple response, there are like 700 even more than that with the two books combined questions. And if you can master those, then you will be fine. And when you're on taking your examination, and Angelique can add to this, when you're taking the exam and you're getting these multiple response questions, don't let them stress you out, because if you are getting them, it means you're doing really well, because those are the most difficult questions. And so if they keep shooting them at you, just sit there and say to yourself, hey, I'm doing great, and it's going to shut off real soon. So, don't be stressed if you see a lot of them.
I think
Anything to add, Angela?
Absolutely. The only thing that I might add, can you guys hear me okay? It sounds like I'm echoing
Yes.
a little bit. Okay. All right. Abby, I don't know, would it make sense to share with them the way that they could access multiple response questions in the Evolve resources?
I think that's a great example. So both students and Linda have already referenced going onto the Evolve resources and selecting it by the format to study. And if you could pull up the Evolve resources that come with the book that you and Linda authored, I think that that'd be really helpful for students to see how they're able to study using those online tools.
Absolutely, I'm happy to do that. Jenna, is there any way you could allow me to share my screen and then I can show everybody how to do that? Let's see, thank you so much. All right, so, and depending on what resource you have, it may be a different color. This one happens to be the Evolve resources for the comprehensive review for the NCLEX-RN exam. And so if you go ahead and you click continue, and then you go into study mode, this is the one that we recommend while you guys are preparing for your exams and for NCLEX most often, because it will give you the practice questions and then instant feedback with the rationale and test taking strategies after. We do also have an exam mode where you can choose to do a 10, 25, 50, or 100 question exam where you don't get the feedback right away, but you can look at the feedback after the fact. And so if you go into study mode, and then you go into, in step 2, you go to alternate item formats, you can then see, and I'm just going to uncheck new questions only just so that you can see how many we have. You'd want to keep that checked so that you got new questions every time. You could click multiple response and you can see just in this product, there's 730 multiple response questions. So this is a good way to study these questions. And one thing that you want to pay attention to with these particular questions are the words select all that apply. And usually in front of the options, you will have a box instead of a circle, which is kind of another indication that you should be selecting all that apply. So just make sure you don't miss those words, because it will change the way that you're going to answer the question.
Great, thank you. So a couple more questions for our students who've joined us this evening. Again, we're really happy to have you here to share your experience. We have a lot of students wondering about how many questions you ended up getting on your NCLEX exam and about how long it took you to learn whether or not you passed.
So for me, with the new rules, I can't remember if the max is 130 or 135. I always get it wrong, but I got 130, so that could potentially be the whole thing. It took me, I want to say, a little over 2 hours, because at the 2-hour mark, which is the halfway point, a little message pops up on your screen and asks if you want to take a break. And I thought that it was telling me that I was done, and it was not. It was just telling me to take a break. But I actually got my results 24 hours later. I got an email from the Board of Nursing just sending me a picture of my license. So it was very bizarre. I was not anticipating it. And it was really quick. So.
Karen, I think you hit the mute again by mistake.
Sorry about that.
That's okay.
I had 98 questions and my exam shut off. With the LPN exam, you could get 205, and because I took it last July, so I had 98 questions, and It took me about an hour and 45 minutes to take the exam.
If I could just add something really quick before we change the question, just something to keep in mind with waiting for your license. A classmate of mine received her quick results, which not every state does quick results, but she received her quick results and then hasn't heard anything from the Board of Nursing in the last 3 to 4 weeks. So she was told that she passed, but her license hasn't come through. So if something like that happens, I wouldn't panic. She ultimately talked to the Board of Nursing and they said everything's good. It's just taking a little bit longer. So although I received mine really quickly, if you don't panic about it.
Great, thanks for that insight, Abby. So Linda and Angela, we have a couple questions in here about the Saunders NCLEX-rn Comprehensive Review. What's new in this edition and if it has a brand new set of questions. Do you guys want to jump in on that real quick?
Sure. Do you want to start, Angela, or do you want me to start?
You can start and then I can jump in after.
Okay, so we've made quite a few changes in terms of the book and the way it's formatted. We have added a complex care chapter to the book because of the NCLEX test plan, and we follow the NCLEX test plan in designing and creating, the chapters and what is going to be in the content of the book. We looked at every question. Not every question is taken out and replaced with brand new questions, but every question is reviewed by several reviewers and to ensure that they're up to date as far as content and what's happening out there in clinical and in what the textbooks and evidence-based research is saying. And we have added numerous new questions in several different areas, in addition to complex care questions, sepsis questions, shock questions, various different content areas. So those have all been added. We've also added some next generation NCLEX type questions to give students, and even though current students who are graduating and getting ready to take the NCLEX will not see the NGN questions on their exam, future students will, and plus for current students getting ready to take the exam, these are great practice for you to test your and measure your clinical judgment skills. So they are there. All of our pharmacology is questions and our pharmacology chapters, which we have 13 pharmacology chapters in the book, have been updated and reviewed, and we have a pharmacist who reviews all of the medications in our chapters and in our practice questions to ensure that they haven't been discontinued or they're questionable or whatever. And he also provides us with content for new medications that should be added to the book. And if he does that, we do add them, of course. And let's see, Angela, what did I miss?
The only other things that I can think of are the way that we code the questions, which allow you to filter for the practice questions in an added way. So for example, we will tag each question at this point with a health problem or a diagnosis to allow students to filter specifically for health problems. So for example, if they have an exam on respiratory coming up and they're going to be tested on COPD and asthma, just as an example, you'll be able to filter practice questions specifically for those health problems and not get all respiratory questions with multiple respiratory conditions. So that was one added feature, just allowing you to filter a little bit further. And similarly with the pharmacology questions, we added the filter not just based off of body system. So for example, not just all endocrine medication questions will come up. You can now filter specifically for the classification. And so if you're looking for oral hypoglycemic medications and insulin, because that's what's going to be on your test, you can filter specifically by that. or for cardiovascular medications, if you're going to be tested on diuretics and antihypertensives, you'll be able to filter specifically on that. And actually, it goes a little bit further. It goes for the antihypertensives, for example, you can do ACE inhibitors, beta blockers, angiotensin receptor blockers, and so forth. So you can get a number of questions to practice specific to the content. And so the idea was to be able to utilize the resource throughout your nursing program and also when you're getting ready for NCLEX.
That's great, thank you. Linda, we do have a student wondering when they're changing the NCLEX exam style. I think there might be a few students who have heard about next generation NCLEX but aren't sure the dates or when that exam will be changing for them. Do you mind sharing a little bit about that with students to ease those concerns?
Absolutely. The current plan by the NClex-pn is that the next generation NCLEX type questions will begin in 2023, so April 1st, 2023, for both the RN and the PN examination. So they'll be implemented for both exams at that time. So students definitely do want to be preparing for those now. So if you are a student who will be graduating that year or any year after that, you definitely want to get ready for those types of questions. How many questions you may have on your exam is still a little bit debatable in terms of the NGNs types of questions. There will be single episode case studies where there will be maybe a 3 to 4 or 5 sentence case study with 1, maybe 2 questions accompanying it. And then there will be unfolding case studies where the story unfolds in terms of what's happening to the patient over a period of time. And with those types of questions, there will be actually 6 NGN item types. So right now they're saying a student may see maybe 4 to 6 to 8 of those types of questions. All of the current types will remain. These will just be added as another type. You will definitely see them. It's just we don't know how many, just like you don't know how many alternate items you might see. So hopefully that helps, but it'll be 2023.
Thank you. Right, so back to our graduates and NCLEX exam test passers, Karen and Abigail. Lots of students wondering if you had any study strategies, test-taking strategies, or study plans that you found most useful. Do you have any more to add on that subject for students who might be concerned or might be taking their exam this summer yet? Abby, we can start with you and then pass it over to Karen.
Okay. For me, something that really helped me stay organized and just on track was making a calendar. So I just printed out a blank calendar and I used a pencil, not a pen, because if I use a pen, I'll have to change it and it'll be a mess. So I printed out a calendar and I just decided how many practice questions I felt like I could accomplish a day while still, doing everything else I needed to be doing and not overwhelm myself. And I just plotted it out on the calendar and gave myself enough time to finish as many questions as I wanted to before my test date. And then, if schedule conflicts came up or maybe I didn't do as many questions as I wanted to yesterday, I could move it around and kind of go from there. So I think that would help you stay organized.
And I also would recommend doing a lot of practice questions. I did 200 a day. As I said, I also would take breaks because I do recommend you do need those breaks in between, but I do feel like you do need to set up a plan to study, and I would do 200 a day. I also would do both books, the comprehensive review and the Q&A, and I also did the PN flashcards, and I would take them with me, and they were also a great study tool because I could take them in my pocket and when I was working, I could bring them with me to work and look at those flashcards also. And it's also good to just do lots of practice questions. Also read the strategy and the rationales, because I feel those are a big tool also, because they also direct you why you're picking that answer and explain. Also, I also think you should ask yourself, when you're reading the questions, maybe you need to reread it and also ask yourself, what is the question asking for? So that is my recommendations for study tools.
Awesome. Well, thank you both. We appreciate both students joining us tonight and our NCLEX authors, Linda and Angela Silvestri. We're just at time. I want to thank all of our students who joined us live as well. Again, this meeting was being recorded and will be available on Elsevier Student Life later this month. Any last minute words, Linda or Angela?
Just, we have some preparation tips here for you. However, Karen and Abigail just shared so much great information with you that they've covered just about everything that we have here. We highly recommend, I know Karen did 4,800 questions and Abigail did 1,000 questions, and that is great. And they were both so successful. And so we're very proud of them. As far as what Angela and I would recommend is that you do at least 3,500 to 4,000 questions before you go into the NCLEX. And for those of you who are still in school, you can be practicing your NCLEX and use that comprehensive review book to help prepare you for your nursing tests, because you're preparing for your nursing tests and you're also preparing for the NCLEX at the exact same time. And we also would recommend, we have some websites for you on this particular slide here. Definitely, and I know the test plan was mentioned by Karen and Abby and by Angela also. The test plan is really important because it actually lists all of the activities that you're going to be asked about on the exam. So we highly recommend that you get on that website and you download that test plan and read all of those activities and master them, and you'll be ready. And Angela?
I don't really have anything else to add to that except to say just to be confident, be positive, know that all of your efforts to the point where you're graduating and sitting down and focusing on studying just for the NCLEX are all efforts that are geared towards preparing you for that. And so that should help you a little bit with easing some of the anxieties of taking the NCLEX exam. And I just think all of the points that were brought up today were all excellent points. And the fact that you're attending today is a great sign that you're very interested in preparing yourself well. And so with that, just stay positive and have confidence and know that all of your efforts will contribute to your success on the exam. Thank you, everyone.
Yes, thank you very much.
Awesome. Have a great night, everyone.